in Long Island, New York, and I came to Florida to practice in the 90s, 1990. About 13 years ago, the mother of my kids was stricken with lung cancer, and she went through chemotherapy, radiotherapy. I was a pediatrician back then,
Mm.
and she got surgery and all the conventional treatment. She passed away 3 years later in 2006, and I became a mother and a father, 3 kids, and it was pretty tough, as you can imagine. Being a doctor and not able to help your own wife, and it was really hard. So that's when I started my search for a different way of practicing medicine, because I saw the way that she deteriorate over the these 36 months that she was receiving all of this treatment. And so I found functional medicine, which actually has been a blessing, because now I'm able to help so many people with chronic diseases. Then I became involved with different patients, ex-presidents and politicians and so on, and that took me back to my country, and I became a director of a big university in Peru. That university, actually fell in love with functional medicine, and get so much engaged that we approached the Institute for Functional Medicine, and now we are conducting educational events in Lima. I brought the whole team of functional medicine in Lima, Peru. So we just celebrated our second applying for functional medicine clinical practice 5-day course in Lima, Peru. I don't know if you're familiar with the Institute for Functional Medicine, but I brought the whole team there twice already, in the past 2 years. So we are conducting a lot of educational events in Lima. Because of that, I became also president of a university in Doral, Miami, of San Ignacio University. We don't have any kind of I would say medical programs there, but in the near future we will. For now, we have business administration, all the things, but um, and they call me, and I have been named the pioneer of functional medicine in Peru. So there's a lot of things that there has been written about me. When I go to Peru, I have a lot of programs in radio, television, and so on. But in any case, this is just to give you my background, how I got into functional medicine. I have 3 practices: one in North Miami Beach, one in Weston, and one in Boca Raton. This is the Boca Raton office, and I am the only physician, but I'm expanding, and I'm also looking for you know people who would like to invest in my practice. So because I have 3 practices, so I need more help. I need to make this more available to people, because as you know, insurances don't pay for this, so everything has to be cash. But the model that I would like to develop is, in my practice, is the membership model, in which people will pay a fee monthly, and they will have some of the services of functional. Yeah, this is just to make functional medicine more available, to people. So that's one of my. So if you know anybody who would like to invest in these practices, I really appreciate it. Let me know. There is a reason why sometimes people get to know each other, because sometimes uh, you know one hand washes the other,
Mm-hmm.
as they say. Um, Conventional medicine is very good for acute problems, and I always make that very clear. But when it comes to chronic diseases, functional medicine is the right approach. And as you know, 70 to 80% of the mortality around the world is now because of chronic diseases. So we are not really living an epidemic; we're living a tsunami of chronic diseases. People don't die from acute problems anymore; they die from chronic diseases. So You know,
Yes.
that's the main thing. Okay, having said that, what I do basically is we go to the root cause of the medical conditions. Root cause of the medical conditions, and we try to achieve the maximum expression of health. We also optimize your operating systems. We have several operating systems like your assimilation, which is your basically GI health. Then your immune system is the second system. Third system is your cellular energy. Mainly is your mitochondrial function. Then detox system, cardiometabolic, hormones and neurotransmitters, and then your infrastructure. So what I do is I evaluate each of these systems and I try to optimize them in order to achieve balance and wellness. So that's the main focus of my practice right now. The last thing that I would like to share with you before we talk about the topic, and I will take only 30 seconds of your time,
Hmm.
is that 50 years ago my mother was very sick. Um, I went to Peru to visit her, and she was down. She was sick. She had been seen by four physicians, top physicians in my country, and she was given 1 year to live. Actually, they told all my brothers and everything. When I heard this, I said, "How can you determine that she has only 1 year?" So I brought her here to the U.S. and I did exactly that. I did a complete evaluation. I optimized her system. She had a number of issues. She had leaky gut. She had food sensitivity to 45 foods. Her microbiome was very damaged, and the immune system, she had CRP, which is a marker for internal inflammation, of 7.8. So she was very inflamed internally. And also her mitochondrial dysfunction was incredible. She had low levels of CoQ10. Her Krebs cycle. We have a test that we do here. It's called the micronutrients, in which we determine also the status of your mitochondria. So she was very, very. I mean, her dysfunction was incredible. Then she had a lot of high levels of arsenic and mercury in the urine. Um, Insulin levels were like 30, was very high. She had a hemoglobin A1C of 5.9. So she was in good shape. Hormones, she had no progesterone, no testosterone, no estrogens, and she had leaky gut. She has probably leaky brain. She was in bad shape. So once I started this treatment, instituted this treatment, within weeks she started to improve. I took her to Europe. When I went back to Peru, nobody recognized her. And this past May, she turned 100.
Oh, wow.
Yeah, she's 100 years old now. So, she's very good. She's excellent. Actually, I'm writing a book in that regard of, how we can impact longevity as well. Not only, your wellness, but also longevity can be impacted by applying functional medicine principles. So, I really feel that that's probably my best testimony is my own mother, So
Hmm.
that's. I just wanted to give you a little overview of my.
It's amazing how a lot of people within the medical field end up changing their beliefs because of how healthcare has impacted their family or themselves.
Right.
Something has always happened, and then they change their thinking and they go look out of the box.
Well, actually, we don't have a healthcare system. We have a sick care system.
Yeah, exactly. They want to keep us sick.
Right.
That's how it works.
They want you to buy the pill every day and for the rest of your life.
Mm-hmm. Yeah, it's pretty sad.
Right.
But very interesting. Thank you for all that. So I definitely know how I can introduce you and open up the conversation, because I think we align in so many ways because of our own experiences.
Mm-hmm.
And it's amazing how you separate the body symptoms looking
Well,
at
all the system, yeah, and also there is one thing that I always pay attention is the mental, emotional, and spiritual
Mm-hmm.
triad. It's a triad. como triada, ¿no? Triada, tres cosas.
Tri.
Triada, no, pero es
Trío.
una triada. Triada en tu teléfono. Okay, it's a triad.
Yeah, exactly. Because that's the last element that I hadn't figured out yet before I started writing my book was the subconscious, working on the subconscious mind and how our emotions and the way we process things that happen in our childhood actually impacts our health and emotions now.
Okay, have you read this book? It's called One Mind.
No.
I would recommend you to read that book. It is amazing. One Mind. But this goes beyond, because we try to always separate the conscious, subconscious, ultra conscious, you know, but in reality, what this book, and I met in one of the integrative health type of seminars here in Florida a few years back. I met this Dr. I think I want to believe it, Dr. Dooley, Dooley, Dr. Dooley. The name of the book is One Mind. One Mind.
Oh, yes.
He thinks that, you know, he really feels that we are all connected to just one mind. It's like the internet, that we are all connected, but it's only one mind. So, you know, a very interesting book, because, you know, many things in your daily life indicate that we are somewhat connected. You know, for example, I believe that you and me, we are talking right now, but it gotta be something that connected us, you know what I mean? So maybe one person, maybe one thought. I mean, I don't know. There is and how many times have you thought about somebody and you see him or he calls you or she calls you the next day? I mean, we see that all the time, you know, in the medical field, for example. I see patients that I haven't seen for the past 4 or 5 years, and I'm thinking that patient, and I go outside and the patient is sitting in the waiting room. You know what I mean? That happened to me a lot. You know what I mean? So it's like, gotta be some sort of connection. But anyway, that's something that, you know, I recommend you to read, because, you know, I really feel that. Now, coming back to the functional medicine, I want to show you also that we pay a lot of attention to the lifestyles. For example, sleep, nutrition, of course, exercise, stress, and your relationships. So when I see a patient for the first time, I take a look of all the operating systems, which is assimilation, immune system, energy system, detox, cardiometabolic, hormones and neurotransmitters, and the infrastructure. Then the triad, which is emotional, mental, and spiritual. And then on the bottom, I examine the lifestyles that I just mentioned to you. That's my approach. You know, when I see a patient, I try to complete information about that.
Exactly. That's basically my approach too, except I don't do any labs. I don't have the medical license for that, so I don't do the labs.
Right. Well, yeah, no, that's okay.
And I use intuition too. Intuition.
Exactly. So, so for example, you know, patients who come with IBS, you know, that's the topic of, you know, that we are going to be talking more in detail today. There is a difference, you know. I always, when I see a patient with IBS, I don't know if I should call it IBS, you know, irritable bowel syndrome. Many patients who come with those labels, sometimes they actually are IBD, inflammatory bowel disease, you know. And so many of those patients have leaky gut. Many, I would say probably most of them.
I'd say yes.
Yeah, and then they have a number of things that compose that. So that's why when I examine these type of patients, I try not to label them. I, of course, pay attention to the symptoms. Most of the symptoms in this patient is they have, for example, constipation, diarrhea. They have alternation of constipation and diarrhea, bloating. You know, it's a major symptom that they They have, they eat and they just fermentate prematurely all of these foods and produce a lot of bloating, burping, belching. Those symptoms are very important. Of course, nausea. Sometimes they have occasionally vomiting. Um, Abdominal pain is very frequent. Abdominal pain is very frequent. Um, and of course, they have, most of them, they have also some sort of acid reflux,
Mm-hmm.
acid reflux. Now, they may have also some extra intestinal symptoms. For example, we see people with headaches,
Mm-hmm.
a lot of headaches, insomnia,
Mm-hmm.
they cannot sleep very well. Then they have, yeah, you're smiling because you probably
I
have,
had all of that.
yeah, okay. You're probably smiling. Yeah.
That's why I laugh.
So let me just see here one thing that I really want to go in detail because I think it's important. Right here. Mm. When you went the right page, you never. Okay, now.
Just
Okay,
close
and
your eyes and take a breath, and then it'll come.
exactly. Okay, so another extra intestinal symptom that I see often, for example, is people who have a watery eyes, itchy eyes, very
Yes.
itchy eyes. They also have blur or tunnel vision, itchy ears.
Mm-hmm.
Sometimes they have a number of problems like earaches or drainage through the ears. Ringing in the ears, that's another one. It's very, very common to have patients with ringing ears. Stuffy nose, sinus problems. Almost 100% of my patients with leaky gut and intestinal problems, IBS, etc. They sneezing attacks. They have sneezing attacks. Now, chronic cough is another one. Chronic cough. Canker sores.
Mm-hmm.
Canker sores. Then in the skin, we see people who have acne. They have urticaria,
Mm-hmm.
hives, wells, you know.
Psoriasis,
Yes,
eczema,
hair loss,
hair loss. Yep.
hair loss, a lot of hair loss. And then, typically that's something that people don't connect, but irregular heartbeat.
Mm-hmm.
Irregular heartbeat. They always tell me, I eat something and then my heart start palpitating so badly that sometimes I have to stop eating just to help myself. Um, Shortness of breath, chest congestion. Some people even develop an asthma attack. So,
Yep.
okay, now another extra intestinal is joint pains.
Mm-hmm.
Joint pain. Like, oh my God, in the morning especially, they have this stiffness,
Mm-hmm.
limitation of movement. Binge eating. Binge
Mm-hmm.
eating, they have either excessive weight or they are underweight. Sometimes I see the extreme. Water retention. In regards to the energy system, fatigue, sluggishness. I see people often, they become very sluggish, fatigue. Now, this is because of the internal inflammation, because of the leaky gut that is producing leaky brain, but also in many occasions they have a thyroid problem, and the thyroid problem produces adrenal fatigue
Mm-hmm.
because they, for let's say somebody is gluten sensitive, they have developed Hashimoto's, and then Hashimoto disease, and that produces also a mental fogging, sluggishness, poor memory, poor concentration. I saw one patient that actually had a slur speech, and stuttering. Once I heal the gut, after 2 or 3 months of therapy, the stuttering and the slur speech disappear. It's just incredible. Mood swings, anxiety, depression, those are typical, extraintestinal, and just people who have frequent illnesses and so on. So, sometimes the physical exam doesn't tell me much. The only thing that I see in physical examination in these patients is increased bowel sounds. I see bloating. I see people who have, an increase in the abdominal girth. But eczema, we see a lot of eczema along with it, hair loss, people who have canker sores in the mouth. It's a variety of things. Joint pain. Sometimes they don't even have arthritis yet, but they have a lot of pain when you do the passive movements of the joints. Hair loss, I mentioned that. So it's a lot of things that we see in these patients and physical exam. How do I approach them? The way that I approach them is I like to do always a food sensitivity testing. Food sensitivity testing. I think that's crucial. That's very important. In this way, what I'm going to see is not only IgE, which is allergies, but I'm going to see the IgG type of sensitivity. Okay, so those are the things that I see. Number two, I try to assess the intestinal barrier. So I do a testing that is going to provide to me, for example, levels of zonulin. Zonulin is a protein that keeps your intestinal cells together. If you have leaky gut, that zonulin is going to leak into your bloodstream, and you're going to have an increased amounts of zonulin. I also check for histamine levels. Many of these patients, they have an increased levels of histamine that is responsible for the flushing, for the headaches, for the flush, also for the itching. Mm-hmm. I see some for those symptoms of increased heart rate, irregular heartbeat. Some people even tell me that they have like what we call depersonalization syndrome with histamine. They feel like mental fogging, but they feel also that sometimes they are like, where am I? It's like depersonalization. They don't feel themselves in that moment. Mm-hmm. My daughter had that, But anyways, bottom line is that I check also for DAO. DAO is what we call the diamine oxidase. Diamine oxidase is an enzyme that is being produced in your intestinal lining and breaks down the histamine. So when you have leaky gut and your intestine is sick, you are not going to produce enough amounts of DAO. Therefore, you will not be able to degrade the histamine. So if on top of that, you're eating histamine-rich foods or foods that release histamine, you will not be able to take care of that histamine, and then you become very intolerant to histamine. So once you start healing the gut, you will produce again your DAO. Sometimes, of course, I administer the DAO by capsules and help these patients to deal with that intolerance to histamine. So that's the intestinal barrier. I definitely do what we call comprehensive stool testing. What is determining in this testing is how is your microbiome? Do you have beneficial bacteria? Do you have imbalanced bacteria? Do you have dysbiotic bacteria? Do you have any fungus infection, candida especially? Do you have intestinal inflammatory markers, for example, like calprotectin, lactoferrin, and different types of inflammatory markers? By the same token, I also check if they have How is the digestion? Do they have enough amount of short chain fatty acids? Are they producing good amount of pancreatic enzymes? How is the immunoglobulin A, which is your line of defense in your intestine? All of this data is given in this incredible comprehensive stool testing.
Right.
So with that testing, I will be able to see a lot of things. Number one, if you have calprotectin elevated, that means that you have IBD, you don't have IBS. You already have IBD, which is inflammatory bowel disease. That sets the scenario for Crohn's disease or ulcerative colitis, you know, so.
Yeah, so I was almost diagnosed with Crohn's. That's what they have in my family.
Right.
Yeah, so let's focus not on the lab test because that's going to be way over everybody's head. We're going to focus
but that's
definitely on the symptoms.
No, but that's it. That's all I do for the GI. Okay.
No, I know, but most of the people that listen, like, they don't understand. Like, I understand exactly what you're talking about, but they don't understand what that is. Mm-hmm. So we'll focus on the holistic, talking about holistic health. I'll bring you in and you can talk about the difference and you with functional medicine. We'll talk about the root cause, and then go through the body systems maybe a little bit, some of the systems that you cover.
Okay.
And definitely these extra intestinal symptoms, because yes, absolutely, I had a gazillion of those, and I understand it because a lot of my clients have the same thing.
It's very frequent to see that, and especially you have to take into account, for example, let's just pick up one, anxiety, depression, along with this, okay? But this was the main reason for your book. Yes, many people don't know that most of these neurotransmitters are not being produced in your nervous system. It's produced by your intestinal bacteria. We have 100 trillion bacteria living in your large intestine. Very few in your small intestine. But 85% of serotonin is being produced by these intestinal bacteria, 85%, you know? And as you probably know, we have several neurotransmitters. Some of them are stimulators, some of them are inhibitors. In inhibitors, we have, for example, serotonin, glycine, GABA. Mm-hmm. In the stimulators, we have epinephrine, norepinephrine, we have glutamate, we have histamine. It's a lot of, so it gotta be a balance. So if you have too little of the inhibitors, you're gonna be anxious. Or if you have too little of the stimulators, by the way, there is one more called dopamine, the stimulators. If you have low, then you're gonna be more in the depression side, So what am I saying? Why am I saying this is because patients need to understand that intestinal health is very important for your well-being. You cannot talk about, mental health if you don't talk about intestinal health. That's number one. Number two is that your immune system, 80% of your immune system resides in your intestine. 80 to 85 of the immune system. So you cannot talk about competent immune system if you don't talk about intestinal health. So that's why it's important to understand those factors. Somebody about 100 years ago said that death begins in the colon, and he was all right because that's the port of entry for everything. So it's a lot of factors that may affect your intestine. One of them is, of course, foods. Lectins. One of the most well-known lectins is called gluten. Mm-hmm. So we don't have, actually humans don't have the machinery to digest gluten very well. So and yet all of this, most of the foods contain gluten. And gluten activates a number of things in your immune system. That's the main reason why you develop antibodies against your thyroid in a condition called Hashimoto's. There is a great there is a great influence of gluten in autoimmune conditions like MS, like lupus, rheumatoid arthritis, and of course Hashimoto's. Just to name you a few, because we see that gluten actually is the driver of all of these conditions.
Yeah. So I experienced that too. Definitely we can talk about that in the second half. So once we start recording live, we have 50 minutes. So we have 25 minutes, then I have to pause for a few seconds. We can drink some water or whatever, go to the bathroom. And then we record the second half, which is another 25 minutes.
Yeah, but when is going to be that? Today?
I was planning to do it today. If you can't do it, then that's fine.
No, because I have patience. I thought it was going to be like a half an hour. So.
Right. Well, we've been talking a lot about learning about each other, so I guess that was an important part, but that's fine.
Very important. We can have a second session in which we can record. We don't need to talk about a lot of these things. I just want you to have my background in this and you get to know you a little bit and see how we can we can
work together
for program.
Yeah.
But now you know where I'm coming from.
I know exactly where you're coming from. A big part of what I teach, and I don't use any lab tests because I go by whatever they're exactly what they've telling me, where they've come from, how many tests they've already have done, from that phase. And then I teach them how to relax their nervous system. That is my gift. My gift was learning how to calm down my nervous system so that I didn't trigger these stress responses that happen normally. And I eat very healthy. I incorporate nutrition. I incorporate supplementation and all that. But I teach them something that they can incorporate into their lives during any situation for short periods of time to actually keep their levels of stress low and keep their energy levels high. And it's just the routine that I do. And I'm incorporating into the class. And that's what I talk about in the book is how I brought those things together and how I build upon. And I'll share the book with you when it's ready. But I'm going to create a little commercial for doctors so they understand what I do. So then they can give the gift of giving that book to their clients that are trying to relax their bodies. Because it's really for any disease process. Everything is based on stress, inflammation, which you just talked about. So it's how I figured out how to heal my own body on my own and incorporating the things that you do. But I did tests, but through regular doctors, and they would find things here and there. And then I put everything together.
Yeah, unfortunately, there is no good guidance among doctors in regards how to conduct this functional testing because they rely on the conventional testing, which doesn't tell you much, So that's the bottom line. But in reality, I really feel that when you have a condition like IBS, namely IBD or leaky gut, an intestinal situation, I think that first of all, you need to do certain tests, but you also need to optimize the other systems because, and you can do these things at the same time, I mean, not the 7 of them, but at least 2 or 3 together, you know what I mean? So in this way, you can actually advance in your therapy and try to make them feel a little bit better as soon as possible. For example, if I don't have the testing, I will do what we call an elimination diet without the testing.
Right, that's what I do.
Yeah, for example, I tell the patients, try to avoid cow's milk, eggs, shellfish, gluten, of course, peanuts, corn, because
that's a big one.
Those are the foods that are more likely to be involved in all of this. Then you have other, but those are the main source of sensitivities. So, change your diet, try to eliminate sugar.
Yep, that's on there too.
High fructose corn syrup, which is everywhere. And then, you try to eat a little more vegetables. Like here is the problem. Many people jump on the salad. Gotta be careful because sometimes, those vegetables contain lectins, a lot of lectins that are difficult to digest, especially if you already have a problem. So I always tell patients to be, a little bit more careful with that. There is a wonderful book by Dr. Stephen Gundry. It's called The Plant Paradox. Plant Paradox. It's a very nice book in which tells you also that, for example, tomatoes are great, and as long as they are peeled, you know, and legumes are great as long as you soak them the night before, like our grandmother used to do, or if you cook them with a pressure cooker, you know, but otherwise, you know, in order to destroy the lectins, because lectins, you know, can really put a lot of stress on your intestine. Healthy fats, you know, you have to eat healthy fats, because unfortunately, you know, people don't eat healthy fat. They eat out and everything. They eat a great amount of you know, trans fats and so on. But I think that when you start eating, change your diet, I think that's a big event. You know.
Yeah.
Mm-hmm.
That's where I started. So I figured out all those foods. I took them out all on my own. I did all that research for myself, and I got to the same conclusions that you did.
Yes, yes.
But you went to school for it, and I just figured it out.
Yes, okay. Yeah, sometimes that happens, you know, that you have to figure it out yourself.
Yeah.
But that is, you know, that is the main, of course, stress is very inflammatory. That's another, you know, the stress is very inflammatory. And you have to learn ways, you know, difficult to stop the stress from coming in, but if you can try and learn things to deal with it, to deal with the stress. For example, there is what we call, what's the name of this? Is the ¿cómo se dice? Es que emotional freedom technique. Is the acupressure, is the tapping, emotional freedom technique. You know, meditation is another one.
Yeah, I use that in my program. Meditation, hypnosis.
Right. Yoga,
body work.
exactly. Those things are very important in order to keep your stress down. You have to work also on your relationships with your surrounding, with your family members and so on. You know, you have.
I talk about boundaries and how it's important to set up boundaries and start speaking for yourself, because a lot of times we don't express what we really feel. We just keep it inside.
That's very.
It causes pain and causes symptoms.
Stay away from the emotional vampires.
Yes, I talk about that too.
Yeah. ¿Estás traduciendo? Emotional vampires. That's and unfortunately there are a lot around us. You know what I mean? So they very toxic people. They try to take all of your energy, and it's difficult to deal with those people because sometimes they make you feel guilty.
Absolutely. Yeah. Absolutely. So let's plan when we want to record the actual show. They go live every Thursday.
Okay, so let's do it next Tuesday. We
can do it next Tuesday. It wouldn't go live till the following Thursday because I have to submit today for next week. So I'm going to record something now.
Okay.
That's fine. Tuesday will work. At what time is good for you?
Probably like around 3 p.m. would be best. How long is it going to take, more or less?
We're going to get on. Like, I'm going to send you like the questions. And as soon as we get on, we'll talk for 5 minutes and start recording. It takes 50 minutes. That's it.
Perfect. Okay. So you're going to send me the questions. That's going to help us out.
Because now that I have, the input.
Now you have all the information that you need in order to formulate the questions.
Sure. Exactly.
Perfect. Excellent.
Perfect. Yeah. So Tuesday at 3 o'clock, I'll leave work early to make sure I'm home by then.
What is it?
I'll be ready for you at 3 o'clock. We'll record on Tuesday, which is January.
Yeah, but what I'm saying is that how long is going to take the actual recording?
50 minutes. So if we start at 3 o'clock, it'll be done before 4 o'clock.
50 minutes. Okay.
50.
Okay, let's do that. Okay, I'm gonna put it in my agenda. Let me see here.
January 7th.
So next Tuesday is gonna be January 7th.
Yes, the 7th.
I can even do it before, but you said that you're working until what time?
Yeah, I'm gonna have to leave work at 2, so it's better for me at 3. Because I'm at the office, I have to drive home.
Well, I can do it from anywhere, right?
You can do it from anywhere as long as it's a quiet place. You don't want to have like phones ringing and things because it'll come out.
Okay, so recording podcast, right?
Yeah.
With Diana. Let me see here. With Diane.
Yes.
Diane or Diane?
Diane, D-I-A-N-E.
Diane, and the last name is Vic.
Vic, V-I-C-H.
Okay, and that's gonna run for 50 minutes. Okay, so you're gonna send me the questions, and I guess that's it.
Yeah, I'll send you the questions. I'll type up the information so you have it, and I'll put together your bio so you can see the short condensed one.
Okay.
And I'll send you the link to the Zoom.
Excellent. Okay, thank you so much, Diane. Okay, that's great.
Nice talking. Have
nice
a
talking
great
to you
day.
too. Okay, bye-bye now.
Bye.
Bye.